For this video, this technique requires some setup and some supplies. I have here 2 stretching straps. I've tied a knot, looped it through itself, and thrown them both over the door like a couple of suspenders here. So when I pull them, the knot will pull tighter. Now generally you want to do this in a door that is not going to open toward you. This one does open in my direction. However, it does have a deadbolt. So if that's the case, like use a front door or so, or an exterior door, you want to make sure that deadbolt is fastened and secure so the door is not open and you don't go falling. Now, if you have TRX straps or have access to TRX straps, those will work quite well here, and they're meant for bearing a lot of weight. These stretching straps are pretty solid. They're nylon. They will hold a fair amount of weight, but I still don't want to trust them fully, put my whole body weight into it. I'm going to use it for tension through my arms, for feedback, and for guidance. And if I have particular limitations, like I don't have full range of motion on the shoulder or I have weakness there, this can help to guide and get the elevation without so much effort that you start to compensate or just get you where you need to be. So that allows you to focus and balance better, focus on other things like your spinal mechanics, which is what this video is really about. So I find that when we're going this forward direction, it's best if we go into stride stance, because that works well for us when we're going forward direction, such as when we're walking. Think like a tug of war, that would work better than being kind of more lateral in your disposition. So that makes you pancake and lose balance. Less control also means less stability, more likely to have pain. If you have pain in your back, you're more likely to have it here. So you're actually more supported here and more solid. And that makes it more control, means less likelihood of pinching things or collapsing, having pain. So I can do this with both arms. I can come up here to start with, making sure that I'm pulling in that core. I want to make sure I don't hyperextend my back. In fact, I want to sit in my hips so I can activate my glutes, especially my front leg. I'm going to squeeze and lift from the glutes. That actually drives the hips somewhat forward. Think of like a bridge if you're laying on your back. But we don't want to get the hips out of the chest. Always lead with the chest, but driving through and extending from the hips first, pulling in the core, try to bypass the lumbar spine. Don't go right into hyperextension, especially if that's where your pain is. And especially if you have a flexion bias where extension is painful. And then you're gonna try to extend gently through your thoracic spine without that hyperextension. So it's load the hips, drive through the glutes, push it, rooting yourself, leveraging through, pulling in the core. Don't push the tummy out, keep it back, tucked in, lift the chest, and guide with the hands. But if you keep tension, you can keep those arms out in front of you too, like you're gonna take off flying. But I like to think of this as like you're pushing a cart like up a hill. So you kind of start low and down low, and you're pushing that cart just gently. You don't have to push real hard through your hands. Keep the tension, feel the guidance here. The other cool thing about this is that I can play around with rotation here. So I can kind of start back here, I can pull, I can rotate over here, and then I can come up over here. And if you're comfortable with that, you can even come up and bring the leg in. So I can get a whole body kind of spiral going here. And then the straps help me to keep my balance. It gives me good control. But you can certainly work your way up to that. Switching over the other way. So think about the back leg is gonna come forward as I come up to extension. So flexion bias on the right, on this side. And then we're gonna extend and rotate towards that opposite. So my hand here, elbow and knee kind of come up towards each other. That's the timing of it. It's to synchronize those opposite knee and elbow. So there's a lot of things you can do to kind of play around with those elements and tease out those details, think about the spinal mechanics of extension, different segments, specifically thoracic and lumbar. And with the hips and the pelvis, it's kind of like that sacral area as well. But we want to have that sense of controlling those elements so we're not collapsing or hyperextending or anything like that, to balance that all out. And with twisting, turning, one side is extending, driving forward, the other side is flexing, be able to balance it that way as well. So there's so many little things, but hopefully that'll help to do just that and balance it all out.